Hello, friend. You've asked me a very important question, a very direct question to me as a psychotherapist. You've asked me, what do I think about the classification systems like DSM-5 and ICD-10 that create a system for standardizing the idea of mental health. And I'm very pleased to respond to that because there's often a lot of confusion about what existential therapists think about that. When I was trained as a clinical psychologist in the 1970s in France, we learned to examine people with projective tests and whole batteries of other tests to establish exactly where they fitted into our classifications, which we had at that time. It was interesting because it taught you to think about people's different problems and their different presentations and the different issues they struggled with in a kind of systematic way. And it also created a language that allowed us to speak to each other about what we found in the people we were working with and how we might best deal with that. But one of the problems is that this has become more and more mechanized. As psychiatry and clinical psychology have tried to become more scientific and more objective, the standards and the categories have become tighter and have become more related to the idea of there being organic problems with the person, which has allowed us to think that when a person has mental illness, what they need is some kind of chemical, some kind of medication to set things straight again. Now, the irony about this is that there are actually, broadly speaking, two sorts of what we call mental illness. There are, on the one hand, organic disorders that happen to people mentally and emotionally because there are problems in their brain or in their nervous system and biological reasons why they are different to other people and why they end up being disabled. So that is, for instance, the case with autism. And when a person is born with this kind of problem, it is very important that we have a systematic way of investigating it and dealing with it. But very often there is no medication that will help with that at all. So those people will still need psychological help to help them cope with life from this very different perspective, from being different, from not fitting in to the norm. But a very large majority of other problems are actually emotional, interpersonal, and existential problems. They aren't at all medical problems. They are psychological, but also cultural or political, ideological issues, and they very often are the person just being lost or confused at some point in their life, becoming depressed or anxious because they're not coping with things as they are. Now, to think of that as organically based and fitting those people into the same system that categorizes mental illness is to lead us astray and to make us believe that all these problems need to be dealt with in a medical way. Now, there was a psychiatrist called Thomas Szasz who very strongly argued against this in the 60s and 70s, and who showed that it's important that we learn to deal with these other problems in a much more direct way by dialogue and by enabling people to understand their lives better. So that is what I have dedicated my life to doing, to find a different way of addressing those issues by talking through them, setting them in perspective and getting a hold of them. And that is never to do with fitting people back into normality, but it is always to do with enabling people to make it possible for themselves to live in the world with other people and to live with society as it is, and preferably to learn from their own struggles so that they will then make an effort to change that society that created their problems or the situations that created their problems, so that they can change the world a bit for the better and help other people to prevent the same kind of thing happening to them. So these are social, political, ideological, personal and interpersonal problems that we have to separate out, and we have to work with quite vigorously in another way. Now the question arises, do the categories of ICD-10 and DSM-5, and incidentally there are other classificatory models, there is one in China and there is one in Latin America and there's a separate one for children. So these models are created by human beings in an attempt to get a hold of all the different problems people can have emotionally or personally in their lives. So the question is, as I was saying, are those useful categories and ways of specifying these problems, or can they actually create problems in their own right? Now, I have no doubt that both of these things are true, that sometimes some people use the categories in very positive, constructive ways, allowing the people they work with to actually benefit from their insight. So, for instance, I think dialectical behavior therapy, when it tackles something like borderline personality disorder, really does so in order to understand the lived experience of the person that is classified in that way, and to help the person tackle that, overcome it, and turn it into a strength rather than a weakness. As long as we do that, I don't have anything against the categories. But that is very, very rare indeed. More often than not, people use the categories to kind of judge the person, condemn them, keep them trapped in being abnormal or dysfunctional. And so the person becomes a patient, becomes passive, or becomes very angry, and is lost to the world. That's not useful. What we need to emphasize much, much more is how we can understand how people become estranged, how they become alienated, how they become out of touch with their own capacity to enjoy this precious life they are given, and how they can actually learn to open themselves up inside and change what is difficult, rather than expect somebody from the outside to come in and do that for them. So existential therapy is all about working with the person to help them understand the meanings in their mind and in their life and what's gone wrong with them, in order for them to take charge of that again and set it much more right for themselves. And that usually means changing their lives, changing their circumstances, making decisions about what their purpose is, what their values are. And very often, when they engage with that and they find that, they go beyond the symptoms of the pathology they had previously been damned with. So I think it is very important to have some level of objective language to talk about people's issues, but I have found that that language can be much more to the point if it relates to where a person is in the world, how they relate to other people, to objects in the world, to nature, to themselves, to their ideas, to society, to the cosmos, to a whole range of things, rather than to simplify what's wrong with them and to kind of place a label on them. So by re-engaging the person in this dialogue about what it is they're having trouble with, what it is that is a difficulty for them, rather than to believe that we already know what is a problem for them if they have problems with, say, OCD or something else. We re-investigate it. We don't know what they have this phobia for or why they get so pernickety. We need to find out what it means to them and how they can therefore use that way of looking at the world and going beyond that. And what I worry about and what I see all the time is that by believing that these categories are scientific and objectively valid, we get stuck in placing people in them as if we place them in a prison, and that their only release from that prison, the only key to open up that prison, is a chemical one. And this is so wrong, because the chemistry may actually make it harder for the person to understand why they landed themselves in that position in the first place. So we need to not blind ourselves to the possibilities that person have. We need to recover their energy, their capacity, their possibility, and help them transcend their problems rather than simply labeling them or seeing them as a net in which they have been captured once and for all. So that is my view. My experience is a long one, and I have seen the categories changing so much over the decades. In the 70s, homosexuality was still seen as a form of psychopathology, whereas now we would be scandalized to consider that a form of psychopathology, as we have come to realize that homosexuality is just one mode of being, and that if the person is facilitated to be in that way and claim their right of being who they are, then there is no problem for them. The problem arises when they have to suppress their natural way of being. And I suspect that is true for many other forms of so-called psychopathology, that we tyrannize people into all being the same and fitting into the norm, and that when we liberate ourselves to think about these things in new ways and more open, more free ways, then we will make it possible for many people with many different ways of being to feel entitled to explore who they are and to contribute from what they are and what they can offer to the world, rather than by feeling damned and encapsulated in a so-called scientific observation about them that doesn't help them very much at all. That's my view. I hope it helps. I look forward to having a further dialogue about it, because, of course, these are new explorations, new ideas that we need to carefully work with and see where we get with them. But definitely my 44 years of work with people has shown me that if I don't use these categories and I explore instead where the person is in the world and how I can help them to liberate themselves, they do much, much better than if I freeze them in this very external, objectifying view of themselves. So liberation for me and empowerment are always the objective.